Hey, welcome. I'm Dr. Steve Grinstead, and I want to welcome you to another how-to vlog. I want to really do more of these, giving some information and education about different topics, especially in chronic pain. Today, I want to talk about ways to identify and escape a chronic pain trance. So the first question is, what the heck is a chronic pain trance? Well, to explain it a little bit, I want to tell you that there was a time when my early rehabilitation, living with a painful, debilitating injury, I was in such a place. And for me, the chronic pain trance is getting to a mindset, a mood where everything's dark, everything's hopeless, everything's helpless. I'm suffering and I see no way out. That no matter what I do, it's never going to change. It's going to be horrible, awful, terrible. Nobody can help me. I might as well just give up. Different people hit this pit or this trance in different ways. A lot of people hit it with serious hopelessness, helplessness, depression, and become suicidal. Other people hit it and start using pain meds, alcohol, other drugs in order to cope from the pain of being in this deep, dark, chronic pain pit. So the first step is to recognize, oops, yeah, here I am. I'm right here stuck. I'm stuck down in the bottom. The first thing I want to share with you is it takes a team. It takes a team to help someone. So when I work with people, especially from the freedom from suffering, a journey of hope perspective, the first step is to start identifying who are some potential coaches and guides that they can invite to become part of the journey to help them out of this trance. Many people don't even recognize they're in a trance, so sometimes the first step is recognition. It's taking a look at the denial patterns or the inner saboteur that stops people from getting out of a problem into a solution. It's going to be different from everybody, but building the team, like I said, is the very first step. So the first step is, who are you working with right now? Who is your pain provider? Are you working with a coach? Are you working with a therapist? Are you working with a physical therapist, chiropractor, acupuncturist? Who are some healthcare professionals that are on your team? And then take them through a very strategic process of how is this particular person helping you. We'll take them one at a time. So how's this person helping you? What are they doing? On a 1 to 10 scale, with 1, 2, 3 being not very effective at all and 9, 10 being extremely effective, how effective are they in helping you and to improve your quality of life, your level of functioning, your hope? And let's take a look at it. Now, is there anything else that you would like them to support you with, but you've been hesitant or not able to or not find the words to ask them? Let me help you. Let's come up with a plan. Is it possible that maybe you need to find a different teammate? Maybe this person isn't going to meet your needs. So after we go through any healthcare providers, and then I do the same thing with me. So what do you want me to do as your coach to help you escape this chronic pain trance and gain your life back, achieve freedom from suffering, and move out of surviving and into thriving? What can I do for you? And a lot of times people are really stuck. So we do some brainstorming, and I share with them some different ways. Different patients of mine have asked me for support and help. Things like, well, I want you to help me build a pain flare-up plan. Or, I'm in recovery and I keep having all these cravings to go back to using inappropriate pain meds or just start maybe drinking because my pain gets really bad at times. So I need a plan for that, a relapse prevention plan, a craving management plan. Other people need different things. I need you to call my doctor and talk to them. I would really appreciate it if you could have my family members come in and we can have a session together and explain what's going on for me. So there's a lot of different ways to help people escape from this chronic pain trance. Then the next step is, since many people who live in a chronic pain trance tend to become very isolated, it's time to build a social network, a family and friends support network. So I want them to add some personal coaches and guides on the team. So I'll take them through a brainstorming session of who do they think they can approach? Why would this be a good person to ask? How can they help you? What can they do to help you get out of the problem into the solution? Is this person going to be compassionate? Is this person going to be too enabling? Is this person going to be too controlling? So I want to really brainstorm how to pick appropriate teammates, because getting the team in place is really important. I believe it takes a team to help heal a pain patient and to get out of the chronic pain trance. And as someone who's been down in the bottom of that pit and have helped thousands of people out of it, I assure you that no matter how deep down in the pit you are, it is possible to get out. You just need a plan and you need backup. So building that backup support network is so crucial. Some people need to be working with a mental health professional because some people have serious depressive disorders or unresolved post-traumatic stress, for example, an anxiety disorder, or other kind of mental health problems. They need to be working with someone that understands that. They need to have a plan in place. For many people, they don't need medication right away. If it's very severe, yes, a combination of medication and cognitive behavioral interventions is the best. But not everybody needs to be on medication. And when they do, I want to help you consult with your provider to make sure that you're getting good ones. That you also need to have education about how to use your medication effectively, what to look for and what to look out for. It's very important to be an informed consumer. So I want to educate my pain patients about everything possible in order to improve their levels of functioning and their quality of life. I also want people to be aware of the psychological emotional components of the pain, also known as suffering. Because some people are in this trance because they're suffering. Their physiological symptoms are there, absolutely, but because they've been living with them for so long, they start distorting or amplifying their perceptions of pain. So I want to help people identify this, how to identify how much of your pain is physiological, how much is psychological, emotional, and let's develop a treatment plan for those psychological, emotional symptoms. Now, what I've discovered over the years personally and with all the people I've worked with, if they can bring those psychological, emotional symptom intensity levels down without changing anything on medication or medical interventions, it'll start bringing their physical perception of symptoms down too. So this is very important. This is a big part of achieving that freedom from suffering and climbing out of the chronic pain trance. So I'm hoping this video was helpful. If you have other topics you'd like me to talk to in this how-to series, please let me know. Be in contact. I really want to help this be an ongoing series of how-tos with issues around pain management. I can also do some on recovery from addictive disorders, relapse prevention. There's a lot of different things. Pain, trauma, depression, anxiety, any kind of topics that you can think of, I'd be more than glad to handle. So today, this is just a starting point on how to identify and get out of that chronic pain trance. And freedom from suffering is possible, and it is the way to go. Thank you for joining me today, and I really appreciate you being here with me.